I have now signed a second proclamation declaring a state of public emergency throughout the Gambia.
COVID is here to stay. It's not going anywhere. COVID is here to stay as we have malaria, measles, tuberculosis, any other virus, Ebola, all the rest of it. We just have to live with COVID. And the only way to live with COVID is to respect the COVID protocols. What the WHO advise, we take that advice. What they want us to do, we do that. What they want us to avoid, let's avoid that. And that's the only way we can fight COVID. And eventually, people will come to know COVID more and be able to fight COVID and indeed defeat COVID. We cannot allow COVID to defeat us, imprison us, keep us in lockdowns throughout. We cannot allow that. It has to end somewhere. And the only way we can end this number one starting point is vaccination. We must build strong immunity. And that means we have to be more physically responsible of ourselves, do more practice, outdoor activities, take our vitamin balanced diets, and indeed take the vaccine. The Ministry of Tourism, the government of the Gambia, is very clear about this. We're encouraging every stakeholder, anybody who is within the tourism and leisure industry in the Gambia, be they nightclub, hotels, casinos, bars, restaurants, bureau de exchange, tourist market, tourist taxi drivers, bicycle rentals, car rentals, whoever they are, we encourage them to go and tell their staff to go and vaccinate. If anybody employs any staff who is not vaccinated, you will be deemed unsafe to receive or offer services to tourists. Therefore, if you have a staff that is not vaccinated or staff that are not vaccinated, you will not be licensed by the tourism board or any other government agency to operate within the tourism sector for this year. We have created vaccination centers in different parts of the TDA, and we want people to go and get vaccinated. That is the only way we can declare our destination as a safe destination for tourists to come and visit our country. So on that note, I take this opportunity once again to encourage workers within the tourism industry and the tourism fraternity to go and get vaccinated. Once they are vaccinated, I think that's a starting point.
Some of our colleagues were resuscitating patients and dropping tears. It was something that really shocked us.
See a patient that you can't help, that is going to die anyway. That's the worst it can be.
We lost 3 pregnant women before the Tobaski.
I think all Gambians should go and get tested. Just get you tested, get your COVID injection, and wear your mask, wash your hands, and don't go out where there's a lot of public. I don't, and I still got it.
I was not working with patients directly, but since they brought me here and I see some patients, the way they are struggling, definitely I believe it now. I know that COVID is real. COVID is real.
Mbiɗon toro jama o fof, dental o fof, kulle o ñaw COVID-19 ñaw o wela andande kono mbo wawi haɓede no kaɓorten mo woni kala mo ganduɗa maɗa woni he leydi he wat feere jaa ƴeftoya pengu o sa ƴefti pengu o ɗum ɗon ɓuratma wallu no muccirɗa e ñaw he wona yo a muccu e ñaw he completely kono ɓurte wallu no muccirɗa e ñaw he sa ƴefta pengu o noon teɗa jogui golliroɓe ɓe ƴefta pengu o min bettama laysin pour yo a uddit hôtel ma walla restaurant ma walla bar ma walla night club ma walla casino ma min batta ɗum min jaɓata joni noon komin ñagoto dental o kala mo ganduɗa maɗa ɗo woni wat feere jaaha pengoyoɗa ƴefta penguji ɗi ɗum nafa ma nafa gollirde ma nde nafa leydi ndi hoɓɓe mbawa arka leydi meɗen par ce que a ƴeftan pengu hoɓɓe hooleta ko argo te hoɓɓe ɓe si garani leydi men ndi gandi welata ko ɓuuri men wallu enen ko hoɓɓe garoɓe he leydi he ɓurta men wallu e Gambia he nden noon ɗen ñaago jama o fop yo yimɓe ndentu anniya goto ɓe jaaɓe pengoyo.
Look at my sleep. I think I am cheated. Yes, you are cheated. This is not what they stated on your employment letter.
It's okay. Just give it to me. I think Fatu must explain this better.
Go and see her.
Let me go to our office now. I think I am cheated. Look at my slip. I did not buy PE tax. Why did you deduct it from my salary?
No, Lamin. PE is an acronym which means pay as you earn. Employment income tax is any profit or gain arising from employment. It includes salaries, wages, bonuses, leave pay, overtime, allowances, and commissions. The employer is charged with the responsibility of deducting the tax at source and remit to GRA monthly before or on the 15th of the following month.
Really?
Yes. Any employee who earns incomes from $2,000 and above per month arising from employment in the Gambia is subjected to employment income tax.
But what if my employer deducts my salary and does not pay to GRA?
Then it means your employer is cheating on you and the government. Anytime if detected, your employer will be charged to pay the full amount and you cannot get any document from GRA indicating your tax compliance.
Thank you very much for making me understand. I think from now on, I will be finding out with you to know whether my taxes deducted from the salary are paid to GRA or not. And I will urge every employee to do the same. Thank you very much.
This information is from the Gambia Revenue Authority. For more detailed information about your pay income tax obligations, please visit any of the nearest GRA offices. The Gambia Revenue Authority, collecting revenue for national development.
Challenges for COVID is new. COVID itself is a challenge. It's a new disease. Not much is known about. So much fear about it, and having to deal with people who look after that will be both. You need to deal with their psychology. You need to deal with physically their presence, and the fact that to look after patients that are going to be very, very much not in their best of state in mind, not only because of health, and the risk of death is very high. So you can imagine from the beginning how this thing could look like. When I was told to take up this responsibility, you can imagine how many people will call me and say, why are you taking up this responsibility? Why are you coming back only to be heading some outbreak like this? My name is Dr. Jang. I'm the head of the COVID case management team, and I'm a physician by training and a nephrologist. And I currently head the emergency and the ICU for Banjul of the Edward Francis Small Teaching Hospital. And I'm also heading the nephrology unit of Edward Francis Small Teaching Hospital.
They don't feel comfortable about me working here, but it's something that I have to do because this is my country. So, and I'm a nurse. Yeah, even if my family don't feel comfortable me working here, so I have to save life. I have to help people because maybe they didn't see what I see. Yeah, because maybe they are not in my shoe. If they was in my shoe, they will do the same as I'm doing. Yeah.
My issues with my family is only because I don't have the time for that, like I should. I mean, my daughter has always asked several questions. I mean, why am I coming home so late? And I mean, of course, my wife will have it. I'm sure she won't say it, but she still feel why I'm not there. I don't come home early. When we came first with COVID, when COVID started first, we all stay in a hotel, so hardly we go home. We most of the time spend most of our time in the hotel at the time. Now that we are there, you can imagine sometimes we leave here at 2 a.m. at night. The next morning we are here again. So it's very important. But the other worry is that you find that even your colleagues are scared that you may be a risk to them, so they don't want to be associated with you. My nurses will tell me, family members of staff will say, okay, you must not do COVID duties because you will be the one to bring the disease or you'll die from it.
Before the Tabaski, we used to have 4 to 5 mortalities. But now, alhamdulillah, now we are doing our best to fight against this. So let the people help us and take the vaccines.
ñu ngi ñaan réew bi di gërëm nit ñi bu baax a baax di leen wax ne nag Covid mu ngi fi du dem fenn Covid di fi yeneen feebar yi nee la fay nee waaye nag dañ koy xeex ndax xam ngeen ne choléra bi mu fi ñëwee bu njëkk lu bari la fi def rey ñu bari waaye terewul fi mu ne ñu ngi dëkk ak choléra terewul ñoo dund ñu ngi jël injection vaccination bi léegi nag ñu ngi ñaan mbooloo mi ne ñëpp nañ dem ñu vacciner koo xam ne nag yaa ngi ci tourisme industrie bi di liggéey yaa xam hôtel nga amee yaa xam restaurant nga amee yaa nga xam casino nga amee yaa nga xam ne bar nga amee yaa nga xam ne night club nga amee yaa nga xam ne bureau de exchange nga amee yaa nga xam ne swimming pool nga amee mbaa dangay ne ci tourist market bi mbaa dangaa loué taxi mbaa nga nekk taxi driver lépp loo mën a ne boo penguwut duñ la licence pour nga mun a liggéey ci tourisme bi si bii ñëw ndax boo penguwut dafa mel ni sa béréb bi wóorut te ku wóorut nag duñ la licence pour nga mën a jël tubaab bi di leen jox service mbaa di leen jëfoo mbaa di leen liggéey loolu leer na nit ñi dem nag pengu ci pengu bi mooy li nga xam ne mooy tax nit ñi gën a mën a wóolu pour ñëw suñu réew mi ñëw def fii ñu touriste ñëw fi ñu ngi séntu nag touriste ñëw waaye képp koo xam ne nag amuloo pengu bi foofu ngay taw.
Human beings, naturally, we want things that are easy and things that are cheaper, less dreadful or scary. You will let her go for simpler things. So when COVID came, like any other disease, the first thing is people say it doesn't exist. Next, it won't get here. It's here, no, it's not here. Even if it's here, it won't hurt us because we are black, we are stronger, we won't have this. It's for the whites and elsewhere. Now it's here, the denial is that they're trying to make up stories. All these things they're saying doesn't exist. So you find out that somebody is even positive, the family don't want them to be here. Even today, there are people who are positive and their families don't want them to be taken to the treatment center. You can fight with them, you can do anything you want. they want them to be taken to a treatment center. So the difficulties are many. People accepting it is the difficulty. Even those who accept it, to go through the process is a difficulty. They don't even want people to know that they have it. I didn't see anything special about COVID. I mean, it's like any other flu that you can have. So you don't need to do anything evil for you to have COVID. But people want to hide it, that they don't want to be associated with it.
Janinka taloptano na ming na hedigle soto continuously mkungo ben diming kang almost 3 days mi alon ko amon stop no na join sol be kan diming mbetoto kan continuously, which is I don't even understand, but interfana malon no ko COVID lem, because for the first time nala symptomol and neneni momantara nyo kan mi alon ko safo ko ay ñine feel then tata hospital oro yeng test ya tanina ko na COVID la soto, which is I have to accept because nfongo yalo ne ko mbe mi feel kan is not normal. Then nalaje, that was on Friday, Saturday naje ko na balakando talatale na kundi mo fanan talatale. I asked them for your release na say so gonna, which is I insist and they release me say it so gonna. But after going home nata kolea ko soto minketa tototi continuously from that Saturday, Sunday, mbatata bakele no 2 days ol minke so gonna. I feel like fanka borol yemindi nanke mingi wantara nafa iman nafa sotonye. Then not try continuously kabo Saturday night 10-25 call continuously nata nila ko nita help lale, because me feel kan it's not normal pour katara society kono onni na family yatara nyoka. That was the reason me yatina murunta na back to the hospital.
So some of them will come. The parents are many. I know when we started, it used to be in the evening results will come, and then they will pick up the people who are positive. Often at the time, we didn't have people with symptoms. Most of them were asymptomatic. So they pick them up and they bring them for isolation, and we'll be monitoring them. And some of them will refuse to come to a point that they have to go to the police to go and pick them up. Some will say, okay, if you're going to pick me up, don't come to my house. Meet me up at so-and-so place, and they will walk there. And even some who are quite ill, they will walk there to be picked up by the ambulance. Some will say, okay, if you're coming to my house, make sure they don't put on the siren, because the family or people around will know this is what I have. Sometimes some will come and the family members will not tell them that they're at the COVID treatment center. They will tell them they're in the hospital. So people will look around for them only to find out that they are not in where they probably are promised to be found. So if they happen to die or they've discharged, then becomes a difficulty for them to break the news to the family. And if they are here, sometimes when they are discharged, they will leave, and that's probably when some of the family members will know truly this was what happened. And you know, I'm sure you remember at the beginning we used to have the people with PPEs going to bury patients, dead bodies, and families and communities have revolted and sometimes attacking those people. We've got people coming and wanting to whisk their families away from hospital, and sometimes having confrontation with securities to say that the father or mother or siblings or whoever they are won't be in treatment center.
Advice means sort of mbe mindila mola kabiring dindingol to fokie balto wolo nyinti ko molbe yalon ko covid manke tulundangoti andu mote mo tankandinola covid la foning imari ye from protection da male se mul ma ko ino, because right now ntenga minje nyala wodama yeng testile to be frank kunung ntarta dame janin kanana jang naje ko covid lebe na ha, but nata molje mini yalon ko neje kole yakono nga molje mini yalon ko nyanta ka sey fana ngeje idunta ni toro ko na mi yalon ko hanita fongo nyaaya je niyo be ku yalale oto mbe mobe advice la mobe ya try always ye bloku and always ya try ka mask use, especially in public?
I'll tell you, COVID, there's no way we can be with this mask forever. There's no way we can stop all our gatherings forever. Some will stop, some will not stop. And some of them are not even in gatherings, but COVID will meet them in their houses. There are elderly people who are 90-something years old who are here, they are sick for COVID. They have not been to any gathering before. They haven't been to any marketplace. But probably a grandchild or a son who is a caregiver goes out and pick it and come and give to them. So for those people, they are quite innocent. And for the sake of those people that we love, and for the people that we think are going to be at risk of dying from COVID, nowadays it's not even about age, it's not about even have comorbidity. People are dying here who are as young as 30 years old, 20 years old. And so because of that, pregnant women, nobody wants to hear that a pregnant woman had died from COVID. Nobody wants to hear about a young person, a 30, 40-year-old dying from COVID. So we should endeavor everything we could to protect ourselves and others. And the best way out of it is for us to get vaccinated.
Prunte, woman cannot problem motibake because nimu feneti mi yalon ko kurang olong andu momo sa expect nole ko isa soto nole. So ni min laft yewo mind soto kafo ko nye covid soto le malla fika suti yala aya soto nyaming ite fanan sa soto no wo nyamal. So whatever molbe min fila o be min fola ntela jata kende ya wole kumaya ta nyewoti.
So the things we need to explain to them includes the fact that the risk that is involved in them harming other people, the risk involved in them harming themselves, because if they get COVID and they progress, they could die from it. This disease can become severe. They could need oxygen, and if they don't have it, that could kill them. So those are things that we put to them, and sometimes that would be a reason for them to listen. For those who are ready, but some of them they may never agree. Even if they need oxygen and they're on oxygen, they will still be wanting to go home. Family members will come to you and tell you, "I want Madam So and Mrs. or Mr. So to come home," by every means possible. Even though they may know how ill they are because they don't want to be associated with COVID.
Yes, really so kono. Imang mo must use. The only time naje ko mulka must use time o mina. Wolem kabrimbe finti kanna. But not understanding to wolo nyinti ko. Mbe society economy ya lonko mol mo believe ko COVID sototale. But I think mbafala mol mu meye ko COVID manke business oti andum COVID manke tulundangoti. Mol kana mira ka foko mansa kunda la planolo o tubabo la planolo nyimu feneti mi ya lonko ni dunta kono o tumole mi ikalo mi COVID-19 ti COVID manke kyahanot.
Vaccines are safe, but as you know, nothing is completely safe that you don't have any side effects. You can get fever, you can get body aches of the vaccine because you're trying to ignite your immune system in your body for the subsequent infection of the virus. So you can have those symptoms, and some can have severe symptoms out of it. We know that, but those are very minute, and we don't have any of those often happening in this, even with this vaccination, as far as we know up to now. In Gambia, there are only few cases of adverse reactions, and even those, we can count them out of the 50,000 vaccines that we've been given. So, compared to the number of people who are dying from COVID today, I think, and those who are ill from COVID, it's a million times better to take the vaccine than to wait for COVID to meet you.
Badi mandi kolu bal be kontotal na dia mota jam fala wolem nim sasa ni COVID-19 ba banko be dajila mol be dajila momo bi yalon ko hotel o be restaurant o be fo casino le be bulu bang fo bale be bulu bang fo taxi driver le muiteti bang fo menu be market vendor bang momo fo fruit seller bang momo ibe do ko la tourism sector to be dajila yeta ye pengota ni manyim pengota man sakundate laisino di la pour ye opre institution min kanate pour mol salon ko banko acceptele pour mol kana jang fo gambianol yeta yim pengota ni pengota wobe kala banko be la kaylo so be mol be dani lale ibe dawoda yeta yim pengota wolem na dali.
Assalamu alaikum wa rahmatullah. Alhamdulillahi rabbil alamin wa salatu wa salam ala asrafil mursalin sayyidil awwalin wal akhirin sayyidina wa nabiyina maulana Muhammadin alayhi salatu wa salam. Alhamdulillah badigol mbe ala tentula ala tento kola kasali kilama sallallahu alaihi wa sallam. Mbe yalla ne mumbe kerin jamano kan kibaro la karola mu yalla ko wala keta COVID-19 kuramati. Ay man toro mun sabunu muslimul mako man to mbe ya kala mutale ko jamengol soronta karantalu soronta alabatu dulalu soronta bengol be kum fata bengol muli yalon ko alabatu bengol lomiti anina adama yakol fam mo sabunu naman kenyin kuran di kafu mu COVID-19 sai nata mol na radiyano muli yalon ko na jata kende ya karfa wallema latela ibe nyato karola yenyin kuran wala soto tonya yandi inata fo fanan ko sai boro soto boro mu yalon ko nyanta nyato kuntula walela dukare me muslimo be dalina na fintina o borota isajen kana fo kotan na alabatu dulalla kana fo na adama yalla anda sikeno fanan kute mu yalon ko aben tankala nyin kurangoma boton simum fo no baadi ngole drom be finti be nyin kurangola nyin pengota isaje ateke e lanjuro sotlan kam pour kan alabatu dulalla soron kotan wala kam ballina adama yalla baadi ngole be mo be kumandila kana o kan sake o nyama inshallah na finti nanyim pengu wota mun keda COVID-19 nanyim pengu woti. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Hold on, man. Well, kaya dafa mel ni dañ ma saate di. waaw because li nekk sa appointment letter bi ak li ma gis fii dafa ute. li foog Fatou leeralal ma ko bu baax. moom rek moo la ko mën a leeralal. seetal yéen foo naa da ngeen ma saate parce que man dinuma benn pays tax waaye fu mu nekk nii ñu ngi dog suma salaire bi rek.
déedéet Lamin pay tax mooy pay as you earn naamo boo xam ne la ni sa koom-koom du ñëwee noonu ngay fayee lu mel ni li ngay fayee ko weer bu dee baate liñ laa jox soo demut noppaleku ci at bi wala bonus allowances commission wala liñ laa jox ci sa biir liggéeykaay bi bunti liggéeykaay bi nag ñoo war a jël sarta yooyu ñu dog ci koom-koom yi ma la wax nii fay ko jiyaar yi weer bu nekka wala balaa beneen weer bi di am fukki fan ak juróom.
su fekkee ne compagnie bi dañ toog suma xaalis bi te demuñ fay ko jiyaar yi loolu moom nu moo mel.
képp ku def loolu yaa ngi sàcca liggéeykat bi ak réew mi te saa yu jiyaar yi yëgee loolu bunti liggéeykaay bi dinañ fay lépp ba mut te yow doo am benn kayit bu jógee jiyaar yi di wone ne yaa ngi doon fay sa naam.
gis naa fu nekkee nii li ma def mooy dinaa bàyyi xel bu baax su weer deetee ma dinaa ñëw seet ndax li ngeen ma dog dem ngeen fee ko jaaree waaye tamit xam nga ni li képp koo xam ne mu ngi mel ni man di liggéey nekk liggéeykat comme man war naa mën a seet si man di def comme nu maa def. xibaar bi nag mu nga bàyyeekoo ca Gambia Revenue Authority képp ku bugg a am lu la leer ci lii nga xam ne mooy seen pay tax sa warugar la nag pour nga dem ci GRA office bu la gën a jegeñ Gambia Revenue Authority mooy place bi ngeen a fayee seen naamu yi pour jëm kanami réew mi.
Ishaka Bojan fanan natale pour ka vaccination o tajang comme ka vaccination o ta pengo ni ko vaccination o wolem pengo nyinti pour ka pengo nyinta nyim pengo nyin kumata bakele mbe Gambia betu danela sunkutol ning kebal ning kambanol betu alsina nale nyim pengo da because pengo nyin kumata bakele mbe ngalo ne ko nyi sasa nyi abe kerina nda sototal kon mi alon ko sasa nyi mi alon ko sasa betu la belto so mbal betu danda alfintina alena na ngani pengo nyinta pour mu ngam fantanka wala fisata ke fanjara so ye fantanka ndandi bita ke fanjara ni fantanka naskeno ni dara jara dulalo ise fano jara dulalo ba ni fantanka jani ka jara rosodo ngamra wala ko moyata be tuti so nyimi mbije be yutsol betu danila mo gambe keda gambe no di wala manke gambe no di war as far as sibe gambe janne be danila ena nyimpe ngota because wala ko moyata beti
akanda ko alialo nyami vaccination be kedi bi vaccination mi alon ko be kurane tanga kay kafme ko COVID-19 nimbe akalam da COVID-19 finde tale dum ay mo jamale niyo samba dum amandol niyo sama bara ay batandi bakere so kamala jada kende abunda kafme na WHO so inata makoro ke compagnie jamala dunia kono kay tande ko vaccine e findi pour saya nimol kon nimol vaccineta akura nyin sambo setala because yo kuranje asila jamala ka atoma sila jamala ka mol tankandi so banina da vaccination silo mi alon ko effective ta bake
بسم الله الرحمن الرحيم تراد موريتاني مقيم في غامبي بنجول أتينا اليوم هنا لنأخذ هذا التلقيح الذي نرى أنه مهم لجميع المجتمعات لكي تحصن نفسها من هذا الوباء الفتاك ونحن كما يشاطرون الكثير من الناس نفس الفكرة أن هذا اللقاح مهم لأن كوفيد-19 وباء فتاك لا قدر الله إذا لم نأخذ اللقاح ممكن أن يكون الضرر كثير لذلك ندعو جميع سكان دولة غامبيا الشقيقة أنهم يأخذوا اللقاح وأنهم يكونوا سباقين في أخذ اللقاح.
My name is Ibrahim Abba. I live in Bijolo. I today took the vaccine of the COVID-19, the Johnson & Johnson vaccine. I want to believe that, as it is argued, the major risk or the biggest risk one can take in life is not to take any risks. And if one thinks that taking the vaccine probably will have its own effects, I think the bigger risks, and then as a result you don't want to take the vaccine, I think the bigger risk that you're taking also is exposing yourself to the COVID-19, which could probably kill you, because we have seen people at all ages dying, and then it could also, your family also could come into contact with it, and it could kill your family members as well. We have just seen that happening time and time again. So I think that's the worst that could happen. If taking the vaccine will just make your body hot or pains your body just for a short period of time, will certainly be better than coming into contact with the vaccine or with the virus and then start facing much bigger problem. For that being the case today, I decided to take it, and then I'm encouraging each and every one of you to take it in order to avoid a situation whereby you'll be at work or at school or anywhere else, and then being called and told that, you know, we couldn't hear from X and Y and Z. Wassalam.
Hello, I'm Ajanka Desanyang. I'm from Bakote Housing Estate, and I'm here today to take my COVID-19 vaccine. I've just been vaccinated and would love to urge all of you to come and get vaccinated as well. The process is very smooth and easy. It's just a normal injection like any other injection. You just come, get the injection, get your card, and just you're vaccinated for good. Thank you very much.
My name is Suleiman Sohna, Commander, and I thank God and I'm happy that I have this vaccine. It's an opportunity that no Gambian should miss.
Umandene jalolti tujereng nga vaccine injection otale pour kan tanka coronavirus la corona jankaro la so mbe mbadi Gambianol be fenkela pour isafinti mo be ne la injection ota.
assalamu alaikum bandiraɓe am fulɓe ko min Awa Kume mina liggo Serekunda General Hospital Kanifing General Hospital mi ara ƴettugol pengu wiyeteɗo coronavirus ko vaccine joni ɓe wi enen fof yimɓe fof yo ara l'hôpital uji he ƴetta vaccine o waɗa en ar tawi en heɓata hay pawgal gotal.
man tey suma tànka li fi mooy fi nekk mooy pour ma ñëw pengu ji because ñu ngi doon wane like almost about a day one more day pour pengu bi jeex so léegi loolu ma fi indi woon ma gaawalantu rooj fekk leen indi kontaan na trop ba polyclinique laa demoo ñëw ma ñu ngi fii ma ñëw so it was good gaaw na efficient na and that is the Johnson & Johnson soo ko pengu benn yoon nga koo pengu so loolu moom kontaan nañ ci trop so maa ngi urge everybody mu génn ñëw pengu si because lii moom feebar boo xam ne faju li olof dee wax ne fagaru mu gën faju ñu yaa ngi ñaan ku nekk nañu génn pengu dara métti wu ci gaaw na ba bëgg a dee waaw te moo gën
waaw nii mooy ñun ñu ngi fii si Tabakoro si juma bi pour jël pengu Johnson & Johnson bi so suñu benn xarit moo ñu wax ne fii mu ngi open so nit ñi bariwuñ so ñu roos ñëw fii fekk fi itam mu ngi open so amuñ fi benn problème gars yi RVTH personnel bi treat nañ ñu nice so pengu nañ amuñ benn difficulties so ñu ngee ñaan nag wala maa ngee ñaan Gambian yi pour ñu déglu télévision yi radio yi ñu ñëw pengu parce que pengu bi baax na dafa fagargu dafa dimbale ku nekk dimbale dëkk bi dimbale nit ñi dimbale aduna parce que suñ pengu wut soo fi feebaree tamit da ngay si lopitaan bi coono te coono bi tam mun naa liitu leneen lu nga xam ne kenn séntuwu ko si waaye nañ ñaan yàlla ñun ñëpp ñu ñëw pengu jàppa si pengu bi xam ne pengu bi da suñ njëriñ la amul dara lu moo xam sa yaram amul dara lu bon lu si nekk li nit ñuy wax lii baaxul dafa def lii loolu amut parce que su lu am la aduna kenn du jóg di dem di pengu président bi pengu na ku nekk pengu na vice président pengu na ñëpp pengu nañ nit ñi gën a important si dëkk bi ñuy doxal dëkk bi pengu nañ so yow mi nga xam ne nag yow comme suma maas nga amuloo loo fee njëriñ o amuloo impact si dëkk bi nga ne doo pengu loolu amul benn njëriñ da nga sonal nit ñi rek is better ñu ñëpp ñu ñëw pengu toog jàppa yàlla xam ne nag yàlla fi nekk te yàlla lañ fee bàyyi.
mbokki jullit yi gannaaw bu ñu sante yàlla julli ci yonent bi sallallahu alayhi wa sallam li ma doon laaj biir nit ñi rek mooy ne ñun ñëpp ñu bokka ñu jël pengu bi nga xam ne mooy pengu COVID-19 bi feebar bi dafa lambee àdduna lu ñu xañoon daaw jéeg ñun ñëpp gis nañ ko taxoon nañu tëj jumaa yi ñu terewuñu lu bëri loo xam ne suñ mbiri jaamu yàlla la tax na ren sax kenn aji wutoon maaka lu ko waral mooy lan mooy feebar bi léegi ñoo xam ne ñooñu leen dénka suñu wér-gu-yaram ci réew mi am na luñ ñu wax ci feebar bi ñu ne feebar bi dëgg la am na luñ ñu indil tamit ñu ne loolu mooy pengu bi nga xam ne loolu lañ war a jël pour fagaru kon nag ñu ngi ñaan ñëpp ñu dogaale feebar bi nii ci pengu bi jël pengu bi tamit nga xam ne dinañu musal si tëj juma ak ay tëj jaaka kon nag li ma wax nit ñi di ko aida nit ñi di ko aida suñ boppa mooy ne leen jël pengu bii nii mu nekk matuwaay boo xam ne dafa mat sëkk wasalaamualeykum wa rahmatullahi wa barakaatu.
mare mu sonungo aɗo sonungo kammu kano owa bana ɓe sukkuñini tan togon na ñammuga o bange katakay nalli katakay wa teɓe ga dunade e gatinanagan coronavirus COVID-19 coronavirus jangiro ani angatunandi jangiro ɓe aɗa duna sula sama lengi coronavirus watte ani watte ɓe gaɗo duna mumancuwa aɗa duna sugulancugu aɗa su kisi aɗa su tanga kembre coronavirus watte ani watte ɓe angatunando sugana kahume wara wanyana sababu nga wakati ni watte ke gajana mogo ɓeɗi coronavirus ataguman cundi maniya taguman sube no anga ni waranduwa anna here ndabari anga dukkinana jare kanga mogo ɓeɗi coronavirus ataguman cundi maniya horen kawa jokku ngatte nogodu ngure hata toye kuna ataguman sunye taguman sube no anga ni wari anna khirindi 1025 bane kahu hillo ado karago kahu nyani anta hoho buinan telehondi anga nugusu jarandano narandema inanguti nankinya jare kanga anga ni dema anga sugule dema ndebe ina ken dema ndekina coronavirus ogana pare du tanganay duna hon yonkin sa hampol laqe WHO ida sartun yogudu sahundi ado Ministry of Health manchagunda holla kebe marantenga yonkin sa hanga kun sartunu ni mania angana ni seren kunyini anna kunyi dan seganyan to menga angana ni tegunu anna tegu an seganyan to men nogondi angana ni seren kunyini anna kunyiti ku ali halanwa kembre seredo serenaga anna mitranu hilli to anaga metranu hilli seredo serenaga kana ken to menagai ogana ni tagunu mekamai coronavirus watebe anga tunantara dunasu la sama ada dunasu sugula kembre osugana kahome purna watege gaja awanyana sababu nga watege katini bako maka mobedi joe maka coronavirus ima khempeke ngade ida pengu mbagandia pengu ke iwakin ni dingiran chua kahunyani anta ho tuwana angana daga igara dingiranu benu sugandi pengu ke wotin nugubei anna daga no angana intelle maka mungure andanga ide kaiti nadaga kenga ide kaiti anna kenya koinia inanto ngutu ina pengu ke kinanga pengu ke ananta ngana baka jangoro ke ai soronga hebe ko no pengu ke khibarendi nanti angana utu ananto indinia walla angana pengu ke utu anankarnia hani to nguiti kenga anda sere karni ngebe ga tawunere kundu nda pengu ke utuwa ama hoho nyanga kembre wa besu nyamarni janguro ke wona hero ndabari hero benu gatu nanti ogalla wa kisini bakai kengani na dutanga igara sartu benu ko kembre na pengu ke gautu l'hôpital nganu benu edo dingro benu gari sugandi pengu ke akatni kinni mogobedi na dutanga baka ke watebe go maka dunadi coronavirus watebe anga nanti to ngunyani de iga kebe ko na khibarendi nanti garenya ni hani kembiti tongui covid ke to ngunyani ona dutangai ogono kahume na nyabane awanyana sababu nga janguro ke bakale bulugne baka dunadi mogobedi joema khanwari.
Today as the chairperson of the COVID committee under the office of the Vice President to engage the whole public again with regards to the pandemic that is around the world and that is also affecting the Gambia. Gambia is no exception. We are pleased to say that there is progress in terms of the interventions that are being done. You already know that there is a lot of vaccination going on, and we want to appreciate the support that is given to the Ministry of Health to continue the vaccination. I will urge us to please take advantage of the opportunity that is presented to all Gambians with regards to making sure that they protect themselves from COVID. We all know that COVID is real. It is there and it is still with everybody. If you listen to the global discussions all over regarding COVID, it is increasing, and Gambia is no exception. So I would urge all of us to continue to wear our mask, wash our hands, maintain the social distance, and all other protocols that is recommended by the Ministry of Health and the World Health Organization. If you take these precautions, we are very much going to go towards reducing the incidence and also protecting everybody. So now, today, I am here to appreciate the support that is provided by the United Nations, United States donating some vaccines to the Gambia to the tune of over 300,000, and I am sure other donors are coming in to support this process. I hope that we will all continue to respect and recognize these protocols so that we can get back to normal.
So my name is Dr. Ismail Abaji. I'm a pharmacist by training. I was practicing in the US for a little bit over 8 years. And currently I'm the founder and CEO of Innovrix Global Health. IGH is a healthcare solutions company that opened in the Gambia, just focused on delivering quality healthcare to people all over the country. Lies go around the world before the truth catches up. So we're catching up to misinformation that came out earlier than the vaccines did. So I think a lot of people fundamentally don't understand how important vaccines are, not only for COVID, but humanity. Things like smallpox, measles, chicken, all these different diseases that used to wipe out nations, is because of vaccines, we don't talk about them anymore. And the tragedy is Gambia has actually had a very successful track record in vaccination. So we've always been a nation of people who took vaccinations. But if you talk about the COVID, I think the reason why it's so important is all Gambians should understand what our reality is. We're not a country that could shut down because then the economy dies. We're not a country that's not going to stop social gathering because we are inherently social people. So that cannot go away. So it leaves us with two options. High exposure, which a lot of people are going to get sick. The more people who get COVID end up in the hospital, and a portion of that in the hospital may not make it. Vaccines is the only way where you could minimize the amount of people who both get sick, or if they do get coronavirus, it's not as bad to a point where they need to get hospitalized. So I think it's just our current reality. We have to know that the smartest people in the world have collaborated on the coronavirus vaccine, something that's unprecedented when it comes to vaccine development. Some of our Gambian brothers and sisters who are working at these institutions in the world. So now that we had a vaccine shortage, we have provisions now. So the ball is in our court. We have a role in how the next couple of months becomes for us. And I think vaccinations is our only saving grace, because once again, shutting down the economy, telling people don't mingle with people, those are not realities that we could ascribe to. So it's just so important for us to build our systems, and vaccines are just the most protective thing we could do at this point. I think especially with the Johnson & Johnson, it's one of those things where it's how information is received. What people need to understand too, it's not the United States who just dumped vaccines in Africa. This is part of the COVAX program. It's a part of a lot of key stakeholders, international organizations around the world who also understand the reality of Africa. So all the regulatory bodies have proven, even now with the Delta variant, that it's a safe and effective vaccination. I think right now the world is always going to battle, misinformation, conspiracy theories about the vaccines, but all the regulatory bodies in the world, not only the United States, have approved it. But more than anything else, the Johnson & Johnson, why I think it stands to benefit Africa better, is because of how effective it is. It's a logistics nightmare to track down Gambians to take 2 shots during the right sequence. Now we have a golden opportunity with a vaccination in the Johnson & Johnson that's proven to be safe and effective. Once again, not in preventing coronavirus, but preventing hospitalizations and death from coronavirus. And it's 1 shot. So 150,000 vaccines, that's 6% of our population. So the biggest opportunity is understanding the difference between the vaccines. It's easier to administer 1 shot and you don't have to come back again. So it's just something that people need to understand. All the individuals who are in charge of the welfare of humanity have ascribed that this is something that could be efficient. So we should be celebrating the fact that we have a more efficient vaccine in terms of administration, and not casting misinformation, because the person who might believe the misinformation just might be the unlucky individual who gets COVID and becomes sick enough or does not make it. So I think the conversation needs to start with us who understand educating people about it, but also everybody has to have their hand in this as well too. The easiest way to describe it is, right now you could consider us being at war with the coronavirus, right? Anybody at war, you need a military, you need soldiers, right? When it comes to a virus, there's only 2 ways that you could train soldiers that could fight that virus. One of them is actually getting coronavirus, which is not an unpleasant experience because that comes with the risk of hospitalization or dying. The other option is get soldiers by getting a vaccine, because it gives your immune system the protection it needs to fight off the virus. And which is why some things people have to understand is vaccines' effectiveness isn't determined by people who don't get the virus. You could be vaccinated, but because you are vaccinated, now you have a lower chance of being sick enough to be hospitalized or sick enough to die from coronavirus. But it's just thinking about it for more as your defense mechanism, right? There's only 1 or 2 ways. And I think vaccines is the safest and surest, because the more of our population that's vaccinated, the safer it is, because then our hospital systems also are not overburdened. Because the more people that get sick, Gambia doesn't have a facility of 10,000 ICU beds to take care of people. So the more people that get to the hospital, the more there's a likelihood that we'll lose a lot of people. And we're not a big population. So for 2.5 million people, a lot of places in the Western world, they're vaccinating 1 million people a day, but there's a willingness to it. So Gambia could change the course of the pandemic just by us being committed to the solution that's in front of us. It's spreading more faster, right? And I think it's allowing the layperson who may not have a medical background to understand how viruses work. They're also fighting for survival, meaning they're going to evolve, and science is always going to have to catch up to these viruses, because even the coronavirus itself, the type of virus, is not new. But the Delta variant now that we're faced with, it's showing that it's spreading a little bit faster, right? So it's almost as if we can't let our guards down, because even while now we're fighting the Delta variant, there's other variants that are popping up in the other parts of the world. But I think the silver lining is, even with the Delta variant, we're seeing that the vaccines that have been produced, marked as safe and effective, are also effective with the Delta variant. So the same level of protection still applies, which I think it would have been a different scenario if all the vaccines that we've created is ineffective for the Delta variant. But it's a new reality that we have to face. It's spreading faster. It's in the Gambia. It's all over the communities. So it's just something we have to once again find a fight. From a vaccination sense, we invested a lot in technology, digital records. We have a Wellness on Wheels platform, and we've expressed to the government, we stand ready to help be a vaccination center. We have trained nurses and who could do it. So we want to be part of the efforts. Advocacy, speaking to our customers, because the benefit of a private facility is we have relationships with individuals that we know there's a level of trust. So letting them get access to the vaccine, we start ready to do that, to vaccinate as many people as possible. But also on the recovery end, our pharmacists and doctors have designed tools in terms of symptomatic relief medications for individuals who have COVID and are at home recovering. So the mass majority that might be sick but not sick enough to go to the hospital, Innovarex is a good place to start to get virtual care, where we could do telemedicine with people in their homes to make sure they're doing okay, send them the right equipment like thermometers, pulse oximeters to manage from home. So I think it's two ways, both in terms of helping people recover and then vaccination, being willing to vaccinate as many people as possible. I am Dr. Ismail Abaji, pharmacist by training, founder and CEO of Innovarex Global Health, a healthcare solutions company here in the Gambia. Just wanted to urge all the Gambians out there to get vaccinated. The coronavirus pandemic has been a long and stressful past year and a half, and the virus has shown us that it would not let up until we as Gambians do something about it. Vaccinations is the surest way we have to not only protect each other, but to move past this pandemic. So I urge every individual to find the closest location you could get vaccinated, and please do so. When getting vaccinated, don't stop only with yourself. Speak to people that you love. Try to fight the misinformation about vaccinations. All the vaccinations have been proven to be safe and effective. Us Gambians don't have the luxury of a health system that could take on thousands of Gambians who may be sick from coronavirus. So I just urge every person of influence, be it a religious leader, a community leader, a political leader, people at home, speak to your loved ones so that we all could get behind getting vaccinated and move past from where we are right now. So please get vaccinated. Vaccines have been proven to be safe and effective, and it's going to be a test on how well we as a people could come together and fight our one common enemy, which is the COVID-19 virus. Understand that COVID is not going away. We cannot pray COVID away. We cannot hope COVID goes away. And we also need to understand that the Delta variant is here. And I tell people in every household, any place of work, there's somebody who's already exposed. So the exposure is nonstop, because once again, our reality is social events are going to continue, political events are going to continue, public transportation is going to continue. So every Gambian right now, unless you're locked in a room and not exposed to any human being, you're exposed to the virus. Meaning, even while we wait for the rollout, there's people recovering from the Delta variant right now. So it's one of two things. Every Gambian who's not vaccinated, try to see how best you could get vaccinated. Those who might be exposed, seek out the right information so that you could know what to do to recover. A lot of it is just supportive care. You treat the symptoms. Individuals like pharmacists, we have COVID care packages. A lot of institutions, private and public, could help individuals understand what to do to recover. But we have to rush to a vaccine, but also understand that we cannot limit exposure because it's already all over the place. And I think that's just a reality we have to wake up to every single day.